Assalamualaikum. For today's topic, I am going to introduce you to family health. The first part will be on scope, issues and challenges, and the second part and the third part will be related to health services and development. We shall start with introduction. For family health, we will start what we call from womb to tomb. In those days, family health was practically not there, yet we have started with maternal and child health. However, beginning in the middle of 1990s, Malaysia has embarked our health services to expand from maternal child health services to family health services. The topic is quite wide. It ranges from child health until the elderly, and it includes from topics from the early childhood, even during antenatal care until death. We also have topics that's related to nutrition and health promotion. As we know, a family is a basic unit of society. What is so important about family? We all have family. We take it for granted that we have a family. But we know in our society, if the family breaks down, the society breaks down. That is why this topic is important for, I would say, everybody. Because if you look back in the dinosaur age, when there are very few people, who are the one who actually take care of you? Definitely family. If you are sick, it's your family. So everything revolves around a family. So when we grow up, who takes care of us is our family. And before we actually venture into the world, it is our family that actually who takes care of us. Family is also the first contact that we socialize with, how we learn to socialize. By first, how we relate to our father and mother, we relate to our siblings. That's the first experience in socialization. And we also learn how to take care of our family members who are sick. We also learn how to take care of our grandmother. By then, it is also a learning experience. When we become old, then our children will take care of us. Family also provide the psychological function, as well as not forgetting our spiritual aspect, as well as economic. Our father supports us, become the main provider. Of course, nowadays, our mother also go to work. So they also function as economic, serve the economic function. So basically, what I'm trying to say is family determine your survival and your success. Stressing again the role of the family, having known that we all as a member of a family, we should know our role. And that role, as parents, we teach our children to play that role. So as parents, we become the example to our children. How we take care of them, bring up our children, will determine the outcome of whether they will later do the same thing to us. Family also interacts with the community. Family is not alone. Many families will make up a community, and many communities will make up a nation. So again, I stress that family, the very fabric of family, they are affected by the external environment too. Besides the internal environment, interaction between father and mother, between father and child, and mother, as well as if there is a third extended family, like the grandparents. See, all this interaction will determine how healthy we are mentally, physically, as well as spiritually. And they say a family that eats together and pray together will stay together. But of course, family is also subjected to a lot of pressure, influence from outside, from the media, which we must be careful about. Otherwise, when the family breaks down, the society will break down. Physically, family shares the genes, lifestyle, like eating patterns, So if your father or your mother loves to eat certain kind of food, you will tend to follow. But of course, having said that, children nowadays, they are influenced by the media. They tend to take more fast food than what the parents have been eating, all those traditional foods. This is where the challenge is to the family in cohesiveness and interaction. Of course, children, when they go to school, they are also influenced by their peers and the social and economic political environment, as well as children nowadays are very IT savvy and they are influenced by the social media. So this is a big challenge for the family. Every family need to know what is their role. In order to know their role, they have to have a knowledge, skills, and also the right attitude. Nowadays, before marriage, they have premarital courses. It's good that we should continue to have for example, parenting course on how to be the best parents, and how to nurture our children. This is a continuous skill, and knowing all the challenges outside the family home, we need to continuously update ourselves. We know that throughout our family life cycle, there will be a lot of challenges. No family is not without any problems, but the most important thing is how to address the issues and challenges within the family. Because whatever happened, as we all know, whatever happened to our parents will affect the child. And we know studies have shown that divorced children tend to land in difficulties. And when this happens, they become a problem to society. At every stage of the bringing up our children, there are challenges. When they are young, they may be exposed and vulnerable to diseases for the children. When they go to school, they are exposed to the school environment, to the peer influence. When they go out from school, there will be problems with reproductive health issues, sexuality issues. So every stage of the family life has got its challenges, for which the parents must always be aware and monitor their children so that they can give their best, so that they can educate the child and continue to become better adolescents. And when they become good adolescents, they also become good parents. As parents, we have to know what are the factors that influence our health. A lot of these issues on health status of women, we know that when there's low health status is associated with low socio-economic status. Therefore, the other reason is the education. So the more educated a woman is, it was found that they can actually bring up their children to be better adults. With better education, women are better able to bring up their children to be more healthy and educated as well. We focus a bit on women health issues is because most women in the world, in general, have only minimal schooling. But maybe for our country, we have quite good literacy rate at about 94%. But for some countries in the world, they are burdened with all the responsibilities of bringing up children, of doing all the housework, of even going to work, and also they have to attend to children who need special care. So all this is putting a heavy burden on women. And you know, women also made up of half of the world population, but they own only about 1 in 100 of the world's property. So this is one very big issue. Other factors that can affect women's health is the status of women. In some countries, women are considered lower in status. Also in education. Of course, in Malaysia, we know that women are quite highly educated. Underdeveloped countries, women are getting less, in terms of income and food. More food is given to the male in the family. And women also suffered from a lot of diseases and subjected to violence and exploitation. These are the issues that can affect women's health. Okay, the detailed part of the economic factors, you know, sometimes women become the only head of household. They are divorced or maybe become single parent, and they become head of household, and more often than not, they have to take care of the family that is left behind. So these are the problems facing women, and it's a cycle of poverty and being helpless. So economically, women, all these factors, like the economic factors, do affect their health. And as I said, women's status also, they take care of everything, even looking after the sick and elderly. So I would say we should give a medal, to all the women in the world. We can do everything, We go to work, they do the cooking, take care of the sick. They are the hospital, they are the nurse, They are also taking care of children, even cooking, even going to work. So in terms of demography, women also subjected to exploitation, like the refugees, persecution, and we would say that it's not a small figure. That is why this topic needs to be explored further, but we will see it in the our next lecture. In terms of political factors, things like we do have allocation for health, and like most governments have maternal and child care. So recognizing that women's role is so much important, that is why we started with our maternal and child health care. So that is why our government put a lot of allocation in the beginning in maternal and child care. And of course, family planning, due to the woman who has to bear children every year, and that affects their health. So government has introduced the family planning program earlier on, and also some laws relating to age of marriage, so that women's health will be taken care of, so that early marriage, they are very vulnerable to ill health and serious complications. So our laws relating to early marriage has been taken care of. And in terms of maternity leave, government has, in those days it was just 42 days, now it has gone to 60 days, now it's already 3 months. And of course, laws related to divorce and inheritance is also being looked into. In terms of education, now it's the other way around, where women tend to marry later, have smaller families, but they are seeking better antenatal care, so we are producing better and healthy children. In those days, food and nutrition, we tend to have a lot of taboo. I'm sure now it is. But now we are stressing more on breastfeeding and nutrition for children. And food is available, only that we need a more balanced diet. Environmental factors, I would say now things are much better. But of course, we're talking about the third world country, where they are exposed to a lot of water, air pollution, and women are exposed to diseases like food and waterborne diseases. Local customs, some countries are still practicing harmful practices, the female genital mutilation, but of course there are various classes, from class 1 to class 4. And breastfeeding practices are being encouraged. The challenge is the food taboos is still being practiced during pregnancy and postnatal period. Diseases is both for men and women. Yeah, they are exposed to all the diseases, endemic diseases. Last but not least is violence and exploitation. Women, they are exposed to rape and prostitution and armed conflict, and that's the very, very big issue. Especially for women, I would like to stress a bit more on the reproductive health. As you know, the definition of reproductive health is a state of complete physical, mental and social well-being, and not just absence of disease. And these diseases are those that are related to our reproductive system. So what is important in the definition is what is immediate is we need to give good reproductive health services, which is affordable and safe and acceptable. Long term, important in reproductive health is the education of women. We need multi-sectoral approach. We need to promote gender equity, because in some countries, woman is always the lesser gender, yeah, the lower status, and we need women to participate in decision making. Yeah. Now, reproductive health, yeah, the scope is big. It's about family planning, maternal child care, diseases of the reproductive tract, sexual education, and adolescent reproductive health. Yeah, reproductive means during the period between age 14 to 49. Issues related to reproductive health are abortion and complications, infertility, cancer of the reproductive tract, and post-reproductive, as old age. So sexual health is just as important as our physical health. A satisfactory, safe sex life, ability to reproduce is important for health. Because if we're not able to have a baby, it's going to cause tension between husband and wife. Even a satisfactory, satisfying sex life is important, or else there'll be a lot of problems between husband and wife. So our goal for this sexual and reproductive health is to our people to have knowledge on sexuality, healthy sexuality, have knowledge on what are the infection if they do free sex, and every birth should be intended. That means it's something that you plan, not unintended. Yeah? For example, even before marriage also, if it is free sex, it's become an unintended pregnancy or birth. So what we want is intended, and within the marriage, have a healthy pregnancy and a healthy childbearing. Look at this slide, we're talking about reproductive rights. Reproductive rights means you have your ability to decide how many children you want, spacing, and the timing of your children, and has also attained the highest standard of sexual and reproductive health. That means free from discrimination or violence. Yeah? Violence can also happen within marriage. What we want, our vision in reproductive health is every sexual act should be free from infection, free from coercion. And every pregnancy should be intended, and every birth is a healthy birth. But we have a lot of issues. What is our concern? But what we see, if you read in the newspaper, is a lot of abandoned babies. That is what we call unwanted pregnancies. Maternal mortality, the mother died during pregnancy and birth. Yeah? A lot of sexually transmitted diseases, unsafe abortions, infertility problem, violence against women, and some special group is also our concern among the elderly. Although you're not talking about sexual, but even the elderly, they have reproductive health concerns. The most important and critical is female education. Yeah, that is the critical input for women's health. Yeah, with education, women can help themselves address all the issues, and they know when they are aware and they have the knowledge, they can get information and seek health care, access to health services, and get treatment and medication properly. We as public health people, we need to educate the public to raise the awareness on sexual and reproductive health. So, how do we improve this? We have already government policies. We do this through information, education and communication. We do a lot of research, training, and of course in part 2 of my lecture will be on service delivery, that is the health services. In this slide, I would like to point out about the life cycle approach to women's health. So we're talking about from infancy to the old age. Our health services will try to meet the needs of women from infancy to the old age. We emphasize the importance of health-seeking behavior throughout the life and what services are appropriate to meet the woman's needs. For the time being, we'll go through our life cycle approach from infancy and childhood. So in this slide, we know that girls face considerable health risks because of family preference for boys in some community. But of course, in our community, sometimes it's the opposite. But in many countries in the world, millions of girls do not receive preventive care and treatment and are poorly fed compared to the boys. And also there's an issue of genital mutilation of girls. And during the adolescent period, we need to address the lack of knowledge about sexual and reproductive health. And we don't want our adolescents to have early childbearing, unwanted pregnancy, unsafe abortions, and sexually transmitted diseases. So sexual health education is very important. And during the reproductive years, like 15 to 49 years, many women died related to pregnancy complications. About half of them are anemic. That means we have poor nutrition, and also the issue of having unplanned pregnancy, sexually transmitted diseases, safe abortion, pregnancy complication, and also just like men, they have also suffered from communicable and non-communicable diseases. So what do we do? Our areas for action is we provide preventive services. That is why we try to address the health problems of women throughout the life cycle, from infancy to old age. And we create the awareness on the needs of young girls, including nutritional and other needs. And for older women, it's for screening of diseases. Again, we repeat the importance of 40% of a lot of reproductive health issues, reproductive health problems. At least 40% of all births are unwanted or mistimed. And there are about 50 million induced abortions every year. And many women died, about 500,000 women died due to pregnancy related causes. At least more than 300 million new cases of sexually transmitted diseases and 22 million infected with HIV. What about those women who already passed their reproductive years, those who are 45 years and above? There are issues of facing aging. They are worried about the risk of aging, and women, when in the post-menopausal period, they tend to develop diseases like cardiovascular diseases, gynecological cancers, osteoporosis, osteoarthritis, and diabetes. In conclusion, we all know that a healthy child today is tomorrow's healthy parents and grandparents. So fostering the health of mother and also the father will produce healthy children now and the future. And the point I'm trying to say is that healthy families are the key to stimulating economic growth and fostering development. A country will not prosper if there are so many broken families. And poor, unhealthy families are unlikely to generate productivity. They will be sick, and all their savings will be spent on going to hospital, and all the savings will be spent on medication. And that being sick means you're going to be lower productivity. As a worker, you'll be always on sick leave. And that can affect the productivity at work as well as the economic growth of our country. With that, you must pay attention to your family and have knowledge, and a lot of knowledge, as well as continuously learn about parenting skills so that you can become better parents. Thank you very much. Assalamualaikum.